Continuing through our cardiovascular system, we'll move on into vessels and their circulation. So the blood vessels themselves, we talked about a little bit during the heart, and the blood vessels are our way to get those nutrients and waste products from one part of the body to another. And so we're going to be able to do this with the heart working as our pump, the blood traveling through the vessels themselves, going around through two different circuits. And so we have our pulmonary circuit and then we have our systemic circuit. And within that, it's essentially a closed loop. So things are not being added into them per se as it moves along. It's a single looping system and keeps on circulating around and around and around within. The vessels can change their rigidity via changing their vasoconstriction or vasodilation, and this is going to allow for us to alter blood pressure at times within the body. And when we're looking at blood vessels are somewhat easy to discern because typically they are named after the area of the body that they actually supply. And so they're going to be similar to the name of the bone or to the name of the body region, the muscles that are in those areas. They're all going to have essentially the same name. When we look at blood vessels, we have three basic types. We have arteries, we have capillaries, and we have veins. And so arteries, as we said, under the cardiovascular system for the heart, we talked about arteries as taking blood away from the heart and to the tissues. This is typically going to be nutrient-rich, oxygen-rich type of blood vessels in terms of what's carrying inside of them, other than in the pulmonary circuit. The capillaries are the place where we actually do the exchange. This is where we're going to deliver the nutrients to the tissues, pick up the waste from the tissues, is within the capillaries themselves. So very thin walled blood vessels. This is where we have that ability to quickly exchange things between the tissues and the blood vessels themselves. Veins take that blood that was delivered to the capillaries, to the tissues, and bring it back to the heart. And so their blood is moving back towards the heart itself. In terms of the blood vessels, we go from the aorta, the largest of our blood vessel, into smaller and smaller and smaller branches as we get down into the capillaries, which are then our smallest blood vessels. And then the veins do just the reverse. And so they're going to start to get larger and larger and larger as they move from the capillary beds back towards the heart and then eventually into the right atrium. Blood vessels, regardless of whether we're talking about an artery or a vein, they basically have the same makeup. And the only difference comes into how much of each kind of layer and component they have within. But they have the same three basic layers as well. They have a tunica intima, a tunica media, and a tunica externa, going from the very inside where the blood is all the way to the outside. So if we were to see them in the cadavers, we would see the tunica externa as being that outermost component. That's what we would see in cadavers and models and things like that. The innermost layer is the same in both types that are there. And so this tunica intima that we have is found within the innermost layer there. And that is the layer that the blood touches. This is epithelium. So we have an endothelial lining similar to that of the heart, nice and slippery. Things don't stick to it. The blood just simply passes right past it. The tunica media is the layer that really changes from the two types. And so if you look at the tunica media in an artery, it's very thick. In the tunica media in a vein, there's basically nothing. And it's the smooth muscle portion that changes depending upon whether we're talking about a artery or a vein. And so in the arteries, that tunica media is very thick. We have the ability to do lots of vasoconstriction, vasodilation, and alter the pressure that's inside there. The tunica externa then goes back to being pretty much the same between our arteries and veins once again. And so we have connective tissue that surrounds the blood vessels. Depending upon the type of blood vessel that we're in, there may be more or less of the areolar or elastic cartilage, elastic connective tissue that surrounds the blood vessels themselves, depending upon how much it needs to be able to stretch out. So the arteries themselves even though the arteries have that same basic makeup between each type of artery that's there, we do have different kinds. And so we have things like elastic arteries, we have muscular arteries, and then we have arterioles. And so elastic arteries are those arteries that are closest to the heart. These need to be able to absorb the pressure wave that comes in from the heart itself. And so this is going to absorb kind of that shock, in a sense, that the system gets when we add that big pressure wave and bolus of blood into the system every single time. The muscular arteries are going to be able to change their size and alter the ability to control blood pressure. And same thing with the arterioles as well. And so we're going from having large amounts of elastic connective tissue, so lots of elastic fibers, to having a large amount of muscle within the tunica media, so lots of smooth muscle inside there, to having a large amount of smooth muscle as well in terms of the overall thickness, but the total amount isn't as thick as we have in muscular types of arteries when we see them in the arterioles. A lot of times in the arterioles, they are bunched together into small little areas like sphincters. The capillaries are where we do the gas exchange. So capillaries are for that process of either letting blood into the capillaries, and so like this one where blood flow is going out into the whole capillary bed itself from the arterial side, or we can clamp off these precapillary sphincters and block blood flow through the capillary bed. And what that's going to do is make it so that the blood can only then travel through this thoroughfare channel. And so it's going to get diverted through that thoroughfare channel, and we're going to maintain blood flow just minimally to that tissue. So like if you're sitting down resting, things like your leg muscles don't need to have lots and lots of perfusion. So we can block that blood flow and divert it through the muscles and deliver it to other areas that may be needing more blood flow at that time. As soon as we become active again and our muscles are then functioning, we're then going to allow that thoroughfare channel to open up, and we're going to feed the blood into the capillary bed itself. When we come out of the capillary bed, we head into venules. And so venules are kind of similar to that of the arterioles, in that they're taking the blood now away from the capillary bed itself. And so they're getting that blood to move away from the capillaries. These are relatively small blood vessels as well. And so their blood vessel size becomes larger and larger the further away from the tissue it gets and the closer it gets to the heart itself. In general, when we look at veins, especially compared to arteries, veins have a very large lumen, and so there's a lot of space inside there. This reduces the amount of friction that's inside the blood in those blood vessels, and so the pressure starts to go way down. When we look at the arteries, we have a relatively small lumen, and all the blood is kind of being packed tight together, and so it makes it hard for it to move along within the pathway itself. And so think about having kind of like a hallway. If the hallway is very, very packed with people, and we try and get everybody to move out into the hallway and walk all at the same time, everybody has to move a lot slower because they really have nowhere to move. But if we kind of divert them and move them into opposite directions, now we've got less people in the hallway and things can move a lot faster and a lot smoother within there. So blood pressure keeps on falling and falling and falling as we move through the veins as we get into these larger vessels. Because the veins don't have a pump and they are low pressure, they need some help. And so one of the big ways that we help to get blood from our extremities, especially the legs, back up to the heart, is that we have muscular pumps. And so the muscles that surround deeper, larger veins, as they contract, they push the blood through that blood vessel. And because veins have valves, it's a one-way movement. And so the blood moves up through past that valve, and it doesn't have the ability to come back and bounce back in. So it's going to bounce up against that valve, and it's not going to make it through the valve itself. As long as the valve is intact and competent, then everything is going to be just fine with that. And so the veins have this ability to be moved upon, and you can even see that the veins have very low pressure, and gravity in and of itself works against the blood flow in veins just by simply looking at the vein at the back of your hand. And so if it's below your heart, you'll notice that the vein, in a sense, kind of pops out. But the moment that you take and raise your arm above your head, all of a sudden, it almost looks like the blood drained out of that vein. And effectively, that's basically what it's doing, is gravity is helping to pull it out. But our legs, unless we're walking around on our hands all day long, they don't have that ability to use gravity to help them out. And so they're going to have to rely upon things like the skeletal muscle pump in order to get that blood moving back towards the heart adequately. If those valves in the veins start to fail because of backup of pressure within the system, whether it's because the person is on their feet all day, and so they're just constantly having pressure pushing down on them from gravity, or their genetics have potentially damaged their blood vessels, or they've been pregnant, all of that has the ability to start to impede that movement of blood out of the legs. Even just large amounts of kind of resting and not getting up and moving around for days on end. And when that happens, a person can end up getting varicosities. And so varicosities occur when the valves fail. And now instead of having, in a sense, this valve holding back just the blood that's up here, if this valve fails, now these two valves down here have to hold up all of this blood as well as this blood. And then they can start to fail. And so when that backup starts to occur, that damages the walls of the vessel. And as the walls of the vessel become damaged there, they then start to bulge out. And that's where we get the varicosities that are there. They start to twist and turn and things like that. And the blood starts to pool even more in those vessels. And so it's most common in the blood vessel here, which is our great saphenous vein, runs all the way along the inside of the leg there. And that can start to occur along there, but it can occur in even the tributaries, like we can see in these legs here. And so they're in the vessels that feed into the great saphenous vein as well on there. They can even occur in anywhere that we have unsupported blood vessels. So the vessels closest to the surface of the skin, there's nothing pushing back on them. That's the whole point behind things like support stockings, between support socks and things like that, and compression therapy, is that it's pushing back on the surface of the skin and helping to squeeze that blood through the vessels themselves. So it can also occur in places like the anal canal in the hemorrhoidal veins, and so a person can develop hemorrhoids. They can also get, if a person is vomiting a lot, and so somebody who's, say, an alcoholic, they may get varicosities in their esophagus. And so we may see them there as well. If the blood doesn't get out, and so if we have kind of that blockage and the blood vessels themselves are no longer flowing out the way that they should, we can end up with edema. And so this here happens to be what's called pitting edema. And so you can see that there are two indentations there from pushing on the skin itself. And it's so swollen and so big in a sense that it's literally almost like a stress ball in a sense in terms of the appearance. We can push in on it and it stays there. It'll eventually fill back up, but there's just so much fluid there within the tissues themselves. To look at the blood vessels real quick, we have some specific areas to kind of ponder a little bit as far as the blood flow goes. And one of the more important series of blood vessels that we have is the circle of Willis. And so the circle of Willis begins with the two vertebral arteries. And so we have a right and a left vertebral artery. They come together and join to give us the basilar artery. That basilar artery then enters into the circle itself. That's there. And so the circle is then going to be also fed not just by the vertebral arteries, but it's also going to be fed by the internal carotid. So this little stump, in a sense, here is the internal carotid. So when we look at the circle of Willis, we kind of have something like this. And so we have something that looks in this realm here. And then there's blood vessels that come off this way, blood vessels that come off this way, and then down this way. And so we have the two vertebral arteries here. We have our basilar artery here, bringing blood up along the brainstem there. We then have posterior cerebrals right in here that come off on either side. We then have a posterior communicating, and so the posterior communicating allows for us to connect the blood supply in between the basilar artery and the internal carotid. So right here is the internal carotid as it comes in. Out here going is the middle cerebral. We then come up and we have the anterior cerebral arteries, and so that's what came off extending on up. And then we have our anterior communicating, and so the anterior communicating in between there. And that's the big circle of Willis. And so this ensures that we have good blood supply, good pressure going to the brain at all times. Once we get that blood there, we've got to drain it away. And so we have a series of blood vessels that are going to drain the brain, the blood away from the brain itself, and eventually get the blood going to the internal jugular here. And so that's the ultimate goal of draining all of that blood out. We've got a series of what we call sinuses. And so we have the superior sagittal sinus up along the top. We have the inferior sagittal sinus running down along the middle. And this is kind of in between the two hemispheres of the brain. Those then drain and start to come down through and make their way towards the internal jugular, going through the sigmoid sinus there, going through the transverse sinuses, and on their way out from that point. Another big series of blood supply is coming from the digestive tract. And so we have what we call the hepatic portal system. And so this is blood that's draining from the digestive tract and goes to the liver. And so essentially everything that we're absorbing from the digestive tract is going to make a stop at the liver first. And so this shunts the blood over to the liver, where it can then process what has just been absorbed. And so if it has any kind of lipids to process, if it's got to look and detoxify anything that came in, it's going to stop there in the liver first, and it's going to see what it can do with what has just been absorbed from that meal. That's there. And so from there, we then bring the blood into the liver. It exits the liver through the hepatic veins, and the hepatic veins then drain into the inferior vena cava, so that we have the blood supply running through there, and we process everything, store things that we may need into the liver, do detoxification, and get things moving from there. So here we have our digestive tract. Many of the blood vessels have been removed in terms of the veins, but we end up in this hepatic portal vein, bringing blood from the digestive tract into the liver, and then splitting through the liver itself, and then eventually draining back from the liver into the inferior vena cava on its way back towards the heart. The blood supply to the digestive tract runs along and comes out through a couple of different major arteries that come off of the aorta, the first of which being the celiac trunk. And the celiac trunk supplies primarily the stomach and the liver, the spleen. We then have the superior mesenteric artery and the inferior mesenteric artery. Both of those are going to split off branches and have some major branches that go off towards the large intestines as they make their way there. And so we have our ileocolic artery, we have our right colic artery, and then we have our middle colic artery. Coming off of that inferior mesenteric, we have our left colic artery. We have the sigmoid arteries that come off and go towards the sigmoid colon. And then the last one here is our superior rectal, comes off and goes down into the pelvis. And so we get blood supply going to the digestive tract as well. From here we have a series of slides that kind of goes through the different pathways of blood supply to the digestive tract and to the arms and to the legs and everywhere within the body itself. And we'll look at these more specifically when we get into the blood vessels for lab, but just have a quick look and see what we have here going out. We can see that essentially the aortic arch comes off, gives off its branches, the brachiocephalic trunk, the left common carotid, the left subclavian. And for the brachiocephalic trunk, once it becomes the subclavian artery, basically it's the exact same thing. Axillary artery, brachial artery, comes down, splits into a radial and an ulnar artery. And it's the same on either side of the of each arm. So both arms are the same there for both of them regardless. And the same thing happens once we split from the aorta, is that it goes out towards the common iliacs, and then the common iliacs give off an internal iliac and a external iliac, pop through the inguinal canal, and we get into the femoral artery, and then it's the exact same from that point on down into both legs as well. And so we have the same arteries and the same splits that occurs within each one. On the venous side, we'll notice that we have a lot more veins than we have arteries. And so we tend to have more drainage than we have blood going to the tissues themselves. And this is part of the venous reservoir that we have. And so we've got more blood sitting in the venous side than we do in the arterial side. So we're going to have more veins out there within the whole body. And then coming down into the arm, one of the major differences between arteries and veins going into the arms is that the ulnar and radial veins are deep blood vessels, and they are replaced in a sense superficially by the cephalic and basilic veins. And so the basilic vein running along the side here, coming down along the medial side of the arm, the basilic vein running along the lateral side there. And then in the legs, similar process, we've got some extra blood vessels in the legs compared to those of the arteries, especially when we go below the knee. And so we have a couple of extra blood vessels that we'll see there on the venous side as well.